In this video segment, we're going to introduce you to the basic navigation of your new TheraTouch EX4 and CX4. First and foremost, you'll want to power the unit on with the switch located on the back side of your device. Once the unit boots up, you'll see the home screen. On the home screen, you'll notice you'll have 3 modality options available to use: electrotherapy, ultrasound, and combination therapy, with a 4th option of system settings. As an example, for this segment, we'll talk about electrotherapy. So if I select electrotherapy, you'll see the next page opening up with a menu of clinical protocols, favorites, and manual operation. Very quickly, we'll show you that once you select clinical protocols, you'll see the dial light up, indicating that there is actually a second screen. Keep that in mind as we progress further. I'm going to go back to the electrotherapy screen and I'm going to select manual operation. Here you'll notice 8 industry standard waveforms available for electrotherapy. I'm going to select pre-mod for pain management protocol, and I'm going to select the channel that I want to use. Once selected, you'll see a basic waveform parameter set that's fully adjustable. For example, I can take the carrier frequency, and once this dial lights up, I can now adjust my carrier frequency, for example, up to 10,000 Hertz. At this point, I can navigate down to the bottom of the screen and I can adjust my time for the proper channel. Let's say I take it down to 15 minutes. At this point, I select the amplitude screen and highlight it orange and increase the amplitude to the desired effect for the treatment. And you'll notice that the clock and the timer automatically start. Near the top of the screen, you'll see the ribbon with a back arrow button, the home button, pause, and a treatment stop button. In the case of any adjustments that you need to make, you can simply push the pause button. The timer will pause. The amplitude will go to 0, and you can simply make any adjustments to the parameters or even electrode placement on the patient. Come back to your play button and push to restart your therapy. At this point, you have access to go back to your home screen and actually start a new treatment. To access your evidence-based clinical protocols for electrotherapy, you're simply going to select the electrotherapy modality option from the home screen and then select the clinical protocol menu. Once you land into the clinical protocol menu, you're going to see 2 pages of evidence-based protocols for electrotherapy, indicated by an LED that lights up for a second page. You simply take the dial and you turn it to the second page. Well, you notice the very first indication: acute pain with 2 electrodes, acute pain with 4 electrodes, chronic pain with 2 electrodes, chronic pain with 4 electrodes, increased local circulation. If I scroll to the second page, you have relaxation of muscle spasm, NMES to prevent retard muscle atrophy, and NMES for muscle reeducation. If I scroll back to the first page, we're going to highlight what the eye icons mean next to each protocol. If I select the eye, it's going to provide you with the clinical rationale behind the waveform and the parameter sets that are used for a 2-pad or 2 electrode placement for acute pain based on the literature. You see that the LED lights up. I can simply rotate to the second page and get more of a waveform description. And at the end, you'll see that it ends there. Now, if I want to go back, I use the back button to get back into my clinical protocol screen and simply go into a treatment at that point. From here, it's asking what channel are you going to utilize. For this sake, I will select channel 1, and then it will pull up the most widely accepted evidence-based protocol for acute pain utilizing 2 electrodes. Adjust the time by highlighting it and adjusting it. And then, of course, select your output and increase the intensity to the desired effect. One thing I will point out, is that you have an electrode icon with the output diagram for channel 1 and channel 2. And again, at the top of the screen, you have the ribbon with the back button, the home button, the pause and start button, and the stop icon. How to customize and save treatment protocols. In this case, I'm going to select an electrotherapy protocol for functional E-stim for quadriceps. I'm going to select electrotherapy. I'm going to go to manual operation, biphasic, and then symmetrical biphasic. Obviously select the appropriate channel that we're working on, and then make my edits, which in this case I want 40 pulses per second for the frequency. I want to change my phase duration to 250 microseconds. I'm going to change my cycle time to a 10-second on and a 30-second off rest period. You'll notice that you can fully customize your on-off time, but in this case we have one of our defaults set at 10 and 30. So I'm going to select that option, and then you can simply go back to your treatment screen. From here you can select your intensity and go ahead with your treatment, or you can also select this icon to now name it and store it as a favorite to recall for a later treatment session. We're going to call this FES Quad. So I'm going to capitalize all of the FES, so I'm going to do cap lock and then select the letters I want. I'm going to space, and I'm going to cap once for the letter Q, and then the rest will be lowercase. Once we're done naming it, we simply hit the green check mark, and the unit will now store that as a favorite. To go back and retrieve that favorite, we can go from the home screen. Since we saved it under an electrotherapy protocol, we simply select electrotherapy, the favorites icon, and this is where your new favorite will be stored. We now have 3 stored. You'll notice the FES Quad. Simply pull this up, select the appropriate channel that you're working from, and now you can simply make sure your electrodes are attached and start your treatment.